Good morning. My name is Dr. Carl Chalky, and I am the Chief Executive Officer and Chief Medical Officer at the Retina Foundation of the Southwest in Dallas, Texas. Today, we will pick up our discussion with Reed Jost, who will talk to us about the treatments we are investigating for children with lazy eye or amblyopia. I hope you enjoy this video and continue to watch our series of videos, which will continue next week.
I'm Reed Jost. I'm a research associate in the Crystal Charity Ball Pediatric Vision Laboratory here at the Retina Foundation. As you may know, the mission of the Retina Foundation is to prevent vision loss and restore sight through innovative research and treatment. Over the past 5 years, we have been investigating a novel binocular approach to treating amblyopia or lazy eye. The standard treatment for lazy eye is patching the good eye to force use of the weaker eye to strengthen those connections in the brain. Though this treatment has been the gold standard for decades, not all children achieve 20/20, and there is a risk of vision regression if the treatment is stopped before a certain age. Also, as you may imagine, compliance to this therapy by young children can be very difficult. Thinking about amblyopia, or lazy eye, we know that it develops when there's a mismatch between the images formed in the two eyes. In some children with misalignment of the eyes, strabismus, one eye is looking directly at the object of interest while the other eye is not. In other children, one eye has a clear image, but the other eye is blurry. When the two eyes are mismatched like this, the brain begins to prefer the clearer or straight eye, and one eye suppresses the other eye, turning it off, and then amblyopia develops. The standard patching treatment attempts to overcome this by covering the preferred eye to force the use of that suppressed or weaker eye. However, there is no attempt to treat suppression directly, nor to make the two eyes learn to work together. Given the central role of suppression in amblyopia, we sought to find a treatment that tailored to, specifically, reduce that suppression. We created Binocular Games and animated movies composed of low contrast elements that are only seen by the stronger eye, and the high contrast elements are only seen by the weaker eye. So to see the full image and play the game or watch the movies, they have to be using their weaker eye and stronger eye together at the same time. We are able to do this using the technology in 3D screens for movies or with red-green glasses with tablet games composed of red and green components to separate what each eye sees. With this rebalancing of contrast, the children are able to overcome their suppression of the weak eye and use both eyes together to see all of the game or all of the movie elements at the same time. We have conducted a series of studies over the last few years using this treatment approach of contrast rebalancing, and we've shown that it is effective in treating amblyopia or lazy eye and in getting some recovery of that binocular vision. We also found that it is most effective in young children, but the games and movies we used so far are best suited for children 5 years and older. This year, we received a grant from the Canadian Institutes of Health to collaborate with vision scientists at the University of Waterloo and the BBC to adapt this binocular approach for amblyopia treatment to children ages 3 to 5. Researchers chose a preschool-appropriate short-length show from the BBC catalog. We then went into the code to separate what each eye sees. Some characters and objects are seen by the weak eye, and some characters and background elements are seen by the good eye. To see the full show and follow along with the story, the child must be using their weaker eye and stronger eye together. This forces the use of the weaker eye to strengthen those connections with the brain. With the handheld Nintendo 3DS, we were able to send the binocular amblyopia treatment home for the child to watch the show for 1 hour per day, 4 days a week. We will be monitoring vision before and after the treatment to see how well this treatment works.